This morning we're going to be learning about opioid dependence during pregnancy. My name is Dr. Davina Moss King from Positive Direction and Associates Incorporated. The objective of our workshop is first we will learn the physical effects of opioid use with women as well as children. Second, we'll understand the pharmacological treatments available for the mother as well as the infant. And third, we will learn about an appropriate treatment plan for women pre and post delivery. Women and opioid use. Currently in America, there is an epidemic of opioid use, and what we have decided is that it is a public health problem. There are reasons for that public health problem. Doctors are prescribing medications for women in a disproportionate way, and as a result, it is complications and causes use and misuse of the prescription drug. And such prescription drugs that we know of are Loratabs, Percocets, and oxycodone. The complications that women experience from using opioids are insomnia, the inability to sleep. Usually when a woman suffers from insomnia, they try to drink wine in order to go to sleep, which is one reason why the CDC has said that there are many accidental deaths because of opioid use mixed with alcohol. Also, there are gastrointestinal medical issues. And lastly, there is dependence. Some women don't realize that they are becoming dependent upon the drug. They realize this after the prescription has ended, and they begin to suffer withdrawal symptoms. There's some other information that is very important for us to understand and realize this morning, is that women between the ages of 25 and 54 are most likely to be prescribed pain medications. The reason being, with this age group, these are the women who have children, who also take care of grandchildren and may suffer from chronic pain, headaches, back injuries, and also have abdominal pain. When they go to the emergency room or to their primary care physician, they are usually given opioids as a prescription to take care of this problem. And also, women are prescribed opiates during delivery as well as after delivery, such as a C-section. Some women are in pain and they are given pain medication in order to go through this for the next 5 days while they are in the hospital. Some opioids that we have to understand and what it does. It's a pain inhibitor. It affects brain function as well as the nervous system. It basically slows down the system so that you don't even realize you're having pain at the time. So people are having pain and they realize the pain is coming back every 4 hours or every 6 hours, and that's when they realize, I need to take another pill. Also, we have to understand that when the medication is given, it releases a histamine that causes some skin irritations. So those of us who are counselors or nurses in the audience, we will realize that individuals that are affected by this will scratch a lot, will have dry skin, will suffer from eczema and small rashes throughout their skin because of the opioid. And also there's secondary amenorrhea, which is women miss their menstrual cycle. And this is why a lot of the women do not know that they are pregnant, which is the reasons why we may have some congenital disabilities as the child becomes older. For opioids, there's a half-life of 24 to 36 hours within your system, and withdrawal symptoms can occur once that half-life is over. And individuals realize that because it feels like you have the flu. You have symptoms where your stomach is hurting, you may have diarrhea, you may have a fever. There's various symptoms that you will have that will be the cause of not using your opioid on time, which is a withdrawal symptom. Some withdrawal that we see here there is some vomiting, some shaking, headaches, diarrhea, and sweating, as I had mentioned earlier. Lastly, there are medications that can help an individual that is going through withdrawal. Medically managed facilities will oversee, and those are also called detoxification units. And those detox units normally use methadone, buprenorphine, as well as Subutex in order to help an individual to safely withdraw from the opioid medication. Now let's move on to pregnancy. If you remember earlier in the presentation, we discussed about a woman may miss her menstrual cycle. That's the main reason why there may not be prenatal care on time. The woman may not know that she's pregnant. And because of that, she may develop the baby continuously, and then we go to the third and the fourth month, and then we realize we have a problem. But the woman has been using throughout this time, and there is fetal development that will happen, and also some disabilities that are occurring. Also, homelessness is a problem too. Many of our women that are addicted to heroin or to opioids are homeless, and there's a lack of self-care. So a lack of eating properly, a lack of taking care of themselves, and there are also some high-risk behaviors that we have to always be aware of, such as HIV and hepatitis C. And most importantly, medical coverage is also a problem. We may find that some of our women may have lost their jobs, so they do not have health insurance, which will help them to get through this part of their pregnancy. There are some pregnancy warning signs that counselors, nurses, OBGYNs, and physicians need to explain to the women. Tender breasts, always feeling extremely tired is also a symptom, and also very sensitive to unusual smells. They will need to observe themselves to say, was I upset because of the smell of sausage before pregnancy, but now all of a sudden I have this interesting aggravation when I smell sausage. That could be a symptom of pregnancy. Also, the obstetrician will need to understand what they need to do for an assessment. We may find that some obstetricians may not want to handle or may not want to treat some women that are in active addiction or have dependence. So you want to find an obstetrician that is sensitive to the needs of your client. They will need to understand drug dependence, understand what to do with a woman that may be dependent upon opioids, and be very gentle and sensitive to them. There are some concerns that the doctors may have because of a woman using drugs. The mom, what we're really concerned about is toxemia. We're also worried about communal infections such as hepatitis C and HIV. And lastly, we want to be really cautious about hypertension. What is the blood pressure reading? That can cause miscarriages as well as death with the baby as well as the mom. And looking on the other side of our slide, we notice that infants may also suffer because of the use of opioids. Some children may be born stillbirth. There is a low birth weight, small head circumference, early delivery, as well as death. When we're looking at pregnancy, we're going to focus on the fetus because we're really making sure that there is a safety and a health concern that needs to be addressed immediately. So there are precautions that are taken for the individual right away. We need to make sure that they have the correct opioid medication that is given. If the woman is on heroin, we need to immediately transfer her medication to buprenorphine, which will help her to have a safe pregnancy as well as maintain the addiction. There's also some issues that we have to worry about in utero, such as fetal development. The brain is developed within the first 3 weeks, and because the woman may not know she's pregnant, she has now started using and continue to use. So as a result, different parts of the brain may not be developed appropriately, and that will last in congenital disabilities for the child. There's such things called opioid maintenance therapy. Opioid maintenance therapy is usually given to men as well as women if they would like to discontinue the use of heroin. Our gold standard that we have currently in the United States is methadone, moving on toward buprenorphine, and then we also have Suboxone, which is naloxone and buprenorphine mixed together. And lastly, you have Subutex. When a woman is pregnant, we want to only use Subutex. We want to also pay close attention to the safety concerns for the woman while she is pregnant. Those safety concerns is what we have to really pay attention to. According to Samsung 2008, they're saying you have to be very careful with giving a woman naloxone because the skeletal development of the child will not happen normally, and they've noticed that within animals that they've tested on their site. So we know that we cannot use Suboxone, we only can use Subutex. We want to also pay close attention to the need for an immediate evaluation. Need for immediate evaluation means how much is this woman using every day? Are they using intravenously? Are they using nasally and muscularly? What is happening to their body? Do they have any abscesses on their body which are infected? In that case, we'll need to make sure that they see a physician so that they'll be given antibiotics that will properly treat them so that the infection doesn't travel to the placenta and then infect the baby, which can also cause death. So we need to be immediate on that and make sure that we have those safety concerns in mind and give the buprenorphine immediately. Some other pieces that we want to really pay attention to that can cause some issues if we don't follow through properly. Once a woman understands that she is using and she is pregnant, we now need to make sure that they can be hospitalized for 24 to 72 hours to basically stabilize the woman, to make sure that there are no problems with the baby. We need to give different types of evaluations, assessments, as well as tests. And we need to also identify the length of the pregnancy. How many months or how many weeks is the woman pregnant at this time? And what do we need to do medically to address these issues? Some choices that we have for OMT, I just wanted to share that with you quickly. You have methadone, which can be given orally. As you see, the woman is drinking the methadone. You also have the buprenorphine, which are tablets that you can give to the woman while she is pregnant. And also, since the 1960s, we have to realize that there's a gold standard for methadone. Methadone has been used for several years for women that are pregnant, as well as to help individuals that would like to sustain from using heroin. However, the one piece we need to keep in mind, there's a lack of studies to really understand what happens to children after they're born with methadone in their system. We know they go through withdrawal, but we're not sure what happens to them after the age of 3 and beyond, and if there are any other types of developmental problems. We also need to realize that with methadone, the woman's weight needs to be considered in order to understand what the dosage will be. And we need to also consider what other drugs is the woman using, such as psychotropic medications or SSRIs, to help them with anxiety or depression. How is that medication going to interact with the methadone as well as with the fetus? So those are just some concerns we have right now for the methadone. We have what's called the induction stage, where you gather up all the information and try to figure out where this woman should be when they're taking the methadone. Usually for the first trimester, we start out with 20 to 40 milligrams one time per day to help to stabilize the woman. As the woman gets older, the baby is growing inside. By the end of 36 weeks, we're at 70 milligrams. And at the 38th to the 40th week, we can be up to 80 milligrams prior to delivery. A lot of women are concerned after I have the baby, now what do? Are you taking me immediately off of the methadone? Absolutely not. Keep them on the methadone for the 80 milligrams and then slowly titrate down if they are willing to do that, or they can just maintain on the 80 milligrams throughout the post-pregnancy. Infants that are born with opioid acute withdrawal. Opioid acute withdrawal is also called neonatal abstinence syndrome, or short we say NAS in the delivery room. Infants are born with average weight when the mom uses methadone throughout the pregnancy, and we also realize that with the average weight that could be 6 to 8 pounds, and that could be wonderful for the baby. Now you have a choice. Some women may want to use methadone, and some women may say, I think I want to try something different. If that's the case, their second choice would be buprenorphine. And that has been since the Drug Abuse Act of 2000. Now here you'll see that the milligram tablets are much lower than it is for the methadone, which is why some women have chosen to go this route as opposed to methadone. So the induction period can be 4 to 16 milligrams per tablet per day. And for the third trimester, we can be up to 24 to 32 milligrams tablets per day. We don't do the tablets per day all at one time. You can take the tablets 2 times per day or 3 times per day. and the dose is much lower than the methadone, and also that is because the half-life for buprenorphine is 24 to 36 hours, so it stays into the system a bit longer. Infants that are born with buprenorphine, when the mom was taking that, are born within the 38 to 40 weeks. That is full pregnancy. That is what we really are hoping for. What we find is that there's less traces of opioid in the system when the mom uses buprenorphine, which means that the babies may not withdraw from any type of drug, except for maybe if the mom is using SSRIs. We want to understand that there's more clinical trials that need to be done within the United States. However, at this point, we find that buprenorphine is very effective for the moms. Lastly, what I wanted to share with you is fetal development and birth defects that may happen as a result of a woman that may be using drugs during their pregnancy, specifically heroin, opioids, or they've used methadone. We want to pay attention to this too because there are developmental delays that may occur, spina bifida, glaucoma, cleft palates, language issues. Congenital heart defects is also important to pay attention to, and what we've noticed mostly is that there is a pulmonary valve stenosis that is the result of that. If you have any questions regarding this presentation, you can contact me at www.pdawny.com.